Faster than a speeding bullet. More powerful than a locomotive. Able to leap tall buildings at a single bound. Look, up in the sky. It's a bird.
It's a plane!
It's Superman! Yes, it's Superman, strange visitor from another planet who came to Earth with powers and abilities far beyond those of mortal men. Superman, who can change the course of mighty rivers, bend steel in his bare hands.
Set free by the Teen Angels from his prehistoric block of glacier ice.
Hey guys, have y'all heard about the new computer system UAMS has now? It's called EPIC, or Uconnect, something like that. It's a new way to keep patient records.
Oh yes, I heard it's such a wonderful system that assists with improving quality. Just the other night I went to the ER at UAMS for a scrape on my leg after being involved in one of my wonderfully performed battles against evil. Oh, y'all should have been there to see me. I was kicking evil's butt. Isn't that wonderful?
Spider-Man flying in. I was at UAMS the other day having my web slingers rewired, and the nurse was telling me how EPIC assists with national benchmarking to identify problems such as falls, hospital-acquired pressure ulcers, central line-associated bloodstream infections, and catheter-associated urinary tract infections. When my web slingers run out of web and I fall off the building, I always love it when I can throw down fall mats and bed alarms.
The thing that I think is so great about it is that the system has improvements for me as a patient. My satisfaction is very important when I go in the hospital. EPIC helps with patient engagement and patient-centered care. Well, did you know I can even log on at home and look at some of my records?
What do you mean log on? I have a log I can throw in the fire to keep warm.
Caveman, you really need to come into the current century. This computerized system will increase patient safety and quality of care. Well, just the other day I was on a date with one of those hot UAMS nurses, and she said it helps with the flexibility of her workflow. She also said it helped decrease the rate of adverse medication events.
Spider-Man flying in. Well, it is about the big three: nursing satisfaction, RN clinical indicators, and patient satisfaction. All they give at UAMS is quality, especially on F8. Those nurses know the business.
How wonderful!
Well, I'm so focused on my satisfaction while I stay in the hospital. If the food isn't good and my room is too hot, then that's not good. Not to mention, if I'm there, I want a case coordinator involved with my care. They help with tying up all the loose ends at discharge. That EPIC system is a great way for my case coordinator to be involved.
What I thought was so wonderful is how my nurse informed me of things. Why, that EPIC system had all kinds of patient education information for me. All my wonderful nurse had to do was add information about wound care on my discharge, and voila, my battle scar is healed. Isn't it wonderful?
What happened to the old-fashioned way of doing things? You know, like pencil and paper, or better yet, rock and stone.
Caveman, that just isn't a productive way of doing things. Like I said before, the nurses needed improved workflow. It's important for them to remain satisfied. There's nothing like a satisfied nurse. They need to have adequate nurse-physician interaction. What better way to do that than with EPIC?
Well, I heard EPIC assists with lower mortality rates. Isn't that wonderful? I also heard that these systems are pretty cost efficient. They help reduce increased utilization of tests, reduce staff resources devoted to patient management, and reduce the costs related to supplies.
As a patient, I like to see improvement in outcomes. My cousin has congestive heart failure, and I heard the EPIC can help with readmissions into the hospital. Another important thing is for patients to receive courtesy and respect. It also always helps for the nurses to be careful listeners.
Oh yes, Captain America. It is very important for my nurse to listen to me. It's wonderfully special when she has the time to sit down and talk to me about things. You know, I can tell if she's focused on my care. If she makes eye contact often and follows up on my requests, then I know she's a careful listener. Then the nurse and I will be wonderful.
I just know there's nothing better than the old way of doing things. Hey, have y'all ever choked on a chicken bone?
Caveman, if I didn't know you better, I would say you're not having a good day.
Oh, somebody help me.
Call those UAMS nurses. I don't think it's a chicken bone.
He's pulseless. Get the crash cart.
Okay, I'll go get it. You start CPR.
No pulse. Continue doing CPR.
Oh, you people saved my life. You know, I made a whole lot of money back in the Stone days, and if anyone can guess what I'm thinking, then I'll give you a prize.
Maybe it's that you feel better?
Nope, that's not it, even though I actually do. I know. It's how handsome Superman is.
Oh, thank you.
Oh, brother.
I bet I know. You're thinking about all the wonderful care you got here. I remember this morning as I carefully listened to you. You kept going on about quality of care, the big three, and what your friends were trying to tell you. Now that you've experienced it for yourself, you can't deny it.
You're the winner. Superman, I guess that epic thing y'all keep talking about really is pretty epic. Haha, get it?